Welcome everyone. This is our weekly meeting here at our office, and we have our chief resident again, Kylene. We have all our other residents watching in the room, but the camera can only shoot one way, so here we are. So today's topic is central nervous system disorders. And Kylene, what's your question?
Okay, we have several patients with multiple sclerosis, and they've all come to us in various stages of their disease, seeking help, seeking if we can either slow down or make better their symptoms of lack of body control. The case we have currently is a gentleman who is having a difficult time walking, and so you're familiar with this case. Since he started seeing us, he did stop using his walking cane. But in terms of when you're first assessing a patient and you're having the conversation with them about treatment protocol and expectation, what do you tell them, or what can we expect from treatment with multiple sclerosis or other neurodegenerative disease? And what is it that you choose to focus on if a cure or a fix is not something that is attainable?
First of all, multiple sclerosis or Parkinson's disease, epilepsy, these are central nervous system disorders. And since acupuncture is mediated through the nervous system, you're going to have troubles treating these people because the myelin sheath, especially in MS, is destroyed, and the whole nervous system has been damaged. So the ability to have a dramatic effect on these people, especially if it's advanced MS, as in the case of this current patient, is very, very difficult. And in our clinic, we're very straightforward with them. He had a cane. He couldn't walk without it. So we told him that if you go through our 4-month plan, you'll probably will not have to use your cane. And he was very grumpy, and we told him that we'll get rid of your grumpiness. And he had some sinus issues, and we told him that we will get rid of your sinus problem. But in terms of the MS, I told him we don't have any stats or statistics to show that we have dramatically, in any way, altered that disease. We can make certain symptoms feel better, but the overall progression of the disease, we're not certain whether we can slow it down or not. Now that's this clinic. There are people in the world who do specialize in treating these types of diseases, but this clinic is not one of them. We treat everybody. We'll treat anyone who walks through our front door. But I have a lot of experience, as you know, and my experience is very difficult to create a dramatic effect in an MS patient and a Parkinson's patient. In fact, I've had several cases here where I've treated the patient who had various problems, no mention of MS or Parkinson's, and simply by the way they were responding to the acupuncture, I could tell that they had a central nervous system disorder. And sure enough, I had to wait 2 or 3 years, and finally they were diagnosed. But you can tell when the effect of the acupuncture needle's going in, and you know that pain should go pretty much instantly or within 10 seconds. And when the effect is very attenuated, maybe it's better. And this happens 3 or 4 or 5 times. For sure, there's some kind of damage in either the peripheral system or the central system or both. And so you can use acupuncture sort of diagnostically to determine how serious the neural issue is. We have a patient in here who's been with us for like 3 or 4 years now. And she has this stiffness in her ankle. She's very hard for her to walk. And she had lots of other issues. All the other issues have been resolved. She laughs now. She could never laugh. She was always very, very angry. All that's gone. But she still has this stiffness. So I sent her for a Parkinson's workup, and they said she doesn't have Parkinson's. I'm pretty sure they're wrong. And that's what's going to come out. Because the way she walks, how she talks, it's all slowed down. It's as if she's speaking through blancmange. And I just know that she has some kind of central system disorder. And that's why I cannot make this stiff leg, lower leg, go away. I can make it go away in anybody else, but she will have a little bit of response and then it comes back. The only reason we let her come is because all the other stuff cleared up. But it will come a time when I'll probably have to discharge her because the only thing that's left I'm not really affecting. So,
Sorry. Sabrina's calling back.
thank you. So, for those of you who practice, when you have this kind of patient, I would strongly recommend that you just do not, the results will not be that magnificent. You'll be able to have effects on certain other problems. When it comes to the actual disease itself, I find it's very difficult to slow that down. I wish I could say something different, but that's my experience. And so, hopefully that will help you when you encounter these kind of patients. You can do certain things. You can take some of the pains away. But to actually change the progression of the disease, perhaps we can slow it down. But I've never been able to turn it around. I've had better results with cancers than I've had with these central nervous system disorders. Thank you very much.